Your parent takes blood pressure medication, arthritis pills, or sleep aids like millions of other seniors. But something may be happening in their brain that nobody noticed. Not because the doctors are careless, not because you're not paying attention, but because the connection between what's in the medicine cabinet and what's happening inside the mind is rarely explained clearly, and even more rarely discussed at doctor's appointments. Most people think cognitive decline is just aging. You get older, your memory gets a little softer, your mind moves a little slower, and sometimes that's true. But sometimes something else is happening. Sometimes the very medications designed to help with one problem, blood pressure, anxiety, insomnia, arthritis pain, are subtly altering how the brain thinks, remembers, and processes information. The research is real, the risk is documented, but the awareness is almost nowhere. You might have noticed something already. A parent forgetting recent conversations, losing words mid-sentence, seeming confused in new situations, and you probably didn't connect it to their medications. Most people don't. By the time you finish watching this video, you will understand the medication-cognition connection, recognize the warning signs, and know exactly what conversation to have with a doctor. This isn't about fear. It's about knowledge. It's about protection. Let's begin. A 72-year-old woman takes 5 different medications for blood pressure, arthritis, anxiety, allergies, and sleep. She has no idea that 3 of them have documented links to cognitive changes. Neither did her doctor mention it. Neither did the pharmacist. She just takes them as prescribed, and life goes on. Until one day, her daughter notices something. She's repeating the same questions. She's leaving the stove on. She's struggling to find words that used to come naturally. And everyone assumes it's just aging. But it might not be. The truth is that medical science has established a clear connection between certain medications and cognitive decline in older adults. This isn't theoretical. It's measurable. Studies show that seniors taking particular classes of drugs experience faster memory loss, more difficulty with attention and focus, and accelerated cognitive changes compared to age-matched peers taking different medications. The evidence is peer-reviewed, documented across multiple research institutions, and consistent over decades of study. The reason most people don't know about this is complicated. Medical education doesn't always emphasize medication-cognition interactions the way it emphasizes, say, kidney or liver side effects. Insurance companies don't specifically track cognitive decline as a medication adverse event. And when older adults do experience memory problems, doctors and families often attribute them to normal aging rather than considering the medication list. The knowledge exists in medical literature. The awareness among the general public does not. Here's what's important to understand. This is not about one medication causing dementia overnight. Nobody takes a blood pressure pill on Monday and loses their mind by Friday. This is about accumulated brain impact over months or years, small changes that add up, reversible effects that become less reversible if they continue, a subtle shifting that might be caught early or might be missed entirely until the changes feel permanent. The most researched medication class linked to cognitive decline is called anticholinergic drugs. You've probably taken one, or someone you know has. They're everywhere. And the connection to memory problems is stronger than most people realize. Anticholinergic medications block a brain chemical called acetylcholine. Acetylcholine is essential for memory formation, attention, and the ability to think clearly and process information. When you block it temporarily for a few hours, most people don't notice much. But when you block it day after day, month after month, year after year, the accumulated effect on memory and cognition becomes measurable and significant. Here's where it gets real. Common over-the-counter allergy and cold medications contain antihistamines. Diphenhydramine, the active ingredient in many nighttime cold and allergy remedies, is strongly anticholinergic. So are first-generation antihistamines in general. Prescription antihistamines tend to be newer and less anticholinergic, but older formulations can still carry this risk. Beyond allergies, certain bladder control medications are anticholinergic. Some antidepressants, particularly older ones, have anticholinergic properties. Even some pain relievers and anti-nausea medications fall into this category. You might take one of these medications occasionally and experience minimal cognitive effect. But many seniors take anticholinergic drugs regularly, sometimes multiple ones at the same time. That's when the risk rises. Research shows that seniors taking high-dose anticholinergic medications for extended periods, months or years, show measurable decline in memory, processing speed, and executive function compared to those taking the same medications for short durations or at lower doses. The difference is not subtle on cognitive testing, and families often notice it without any formal testing at all. One crucial detail: not everyone is equally vulnerable. An 60-year-old taking an anticholinergic medication temporarily might show no cognitive effect, but a 78-year-old with underlying kidney problems taking the same medication long-term might experience noticeable memory problems. Your individual vulnerability depends on age, kidney, and liver function, overall brain health, sleep quality, hydration, and sometimes genetics. This is why one person tolerates a medication that another person cannot. What you need to know: if you or a family member is taking antihistamines, bladder medications, certain antidepressants, or pain relievers regularly, especially multiple medications from this class, asking your doctor about cognitive risk is not paranoid. It's wise. The medication that helps you sleep might be making it harder to think clearly. Benzodiazepines, drugs like diazepam, lorazepam, and alprazolam are prescribed for anxiety and insomnia. They're also among the most widely used medications for seniors, even though the research on their cognitive effects is substantial and sobering. Here's how they work. Benzodiazepines slow down brain activity. They calm the nervous system. For someone in acute anxiety or unable to sleep, this can feel like relief. The problem is that sustained use, weeks, months, or years of regular use, is associated with memory problems, confusion, and difficulty with attention and executive function. Long-term benzodiazepine use is also associated with dependency, which complicates the picture further because stopping suddenly can be dangerous, but continuing carries cognitive risk. This raises a real question. If these medications are risky for cognition, why do doctors still prescribe them? The answer is nuanced. For acute anxiety or short-term insomnia, days or weeks, benzodiazepines can be appropriate and the cognitive risk in that window is low. But for chronic anxiety or long-term insomnia, particularly in seniors, the risk-benefit calculation shifts. A senior taking a benzodiazepine every night for 5 years is absorbing cumulative cognitive risk that most guidelines now recognize as inappropriate. Yet many seniors are on exactly that trajectory. What's particularly concerning is the gap between prescribing and awareness. A senior might have been prescribed a benzodiazepine years ago for temporary insomnia and simply never stopped. The doctor might have forgotten it's in the medication list. The patient might not even remember why they started it. And meanwhile, the medication quietly contributes to memory problems, confusion, and slower cognitive processing. Newer alternatives exist. Some are less sedating and less cognitively risky. Sleep hygiene changes often help. Cognitive behavioral therapy for insomnia is effective without medication. But these alternatives require time, conversation, and effort, things that don't always happen in a busy primary care visit. So the benzodiazepine prescription continues. The years pass, and the cognitive effects accumulate. If you or a family member has been taking benzodiazepines regularly for months or years, this warrants a conversation with your doctor, specifically about whether alternatives might work, whether the original condition that prompted the prescription has changed, and whether a gradual transition away from the medication is appropriate. Anticholinergic drugs and benzodiazepines are the most researched, but they're not alone. Several other medication classes carry documented links to cognitive changes in older adults. Understanding the broader landscape prevents you from focusing only on one category and missing another. Opioid pain medications affect the brain. They slow cognitive processing, reduce attention, and impair memory formation. Most people know that opioids can affect mental clarity in the short term, but the chronic use picture is more complicated. A senior taking opioids daily for chronic pain, months or years, is living with sustained cognitive effects that might feel normal to them, but represent genuine slowing compared to their pre-medication baseline. Certain blood pressure medications can affect cognition differently depending on the specific drug. Some beta blockers have mild cognitive effects. Certain calcium channel blockers have been studied for memory impacts. Not all blood pressure medications carry equal risk, and most people's blood pressure control requires medication despite any cognitive concerns. But the point is that even helpful medications sometimes carry cognitive trade-offs worth understanding and discussing. Some diabetes medications affect cognition indirectly through blood sugar control. If blood sugar is too low, thinking suffers. If blood sugar is poorly controlled, thinking suffers. But certain diabetes drugs themselves have also been studied for cognitive effects independent of blood sugar control. The relationship is complex, but acknowledging it matters. Statins, cholesterol-lowering medications, have been studied for cognitive effects. The research is mixed, but some people do report memory problems after starting statins. Most clinicians believe the cardiovascular benefit outweighs the cognitive risk for people at high risk of heart disease. But the issue deserves mention because many people are unaware that statins and cognition have any relationship at all. Here's where polypharmacy becomes critical. Polypharmacy means taking multiple medications simultaneously. Most seniors take at least 3. Many take 5 or more. When you're taking multiple medications that each have some cognitive effect, even mild ones, the combined impact can be more serious than any single drug alone. A senior on a low-dose anticholinergic, a benzodiazepine, an opioid, and a beta blocker is experiencing compounding cognitive risk that none of these drugs would create individually. This is why medication review isn't just about identifying one dangerous drug. It's about understanding the cumulative brain impact of the entire medication regimen and asking whether every medication is still appropriate, whether doses can be lowered, and whether any medications can be eliminated as the original problem resolves. The difference between normal aging and medication-related cognitive change often comes down to speed and pattern. Normal aging unfolds over years and decades. A 70-year-old thinks a little differently than a 40-year-old, and that's expected and gradual. But medication-related cognitive effects often unfold over months. You notice a change. And then the change accelerates or stabilizes depending on whether the medication continues. What specific signs should alert you? Pay attention if you or a family member begins noticing recent memory lapses, forgetting conversations from yesterday, misplacing everyday items, not recalling plans made last week. This is different from long-term memory issues. You still remember your life history, important events, people you've known for decades, but recent events blur. Recent information doesn't stick. That pattern matters. Watch for word-finding difficulty that feels newer or more pronounced. Everyone forgets a word sometimes. But if someone who was articulate suddenly struggles more frequently to find words mid-conversation, pauses more, or uses vague phrases like that thing more often, that's worth noting. Processing speed may slow noticeably. Conversations that used to flow easily now require more thinking time. Responses that used to be quick now come slower. The person might seem less sharp in social situations or less able to follow complex conversations. Confusion in new situations or with new information is another pattern. A senior might do fine in familiar settings with familiar people, but become confused or overwhelmed when facing something unfamiliar. Difficulty following directions, struggling with new technology even if they learned it before, or feeling disoriented in new places, these can signal cognitive changes. Personality or mood changes sometimes accompany cognitive effects. Someone might become irritable, anxious, withdrawn, or uncharacteristically emotional without obvious external cause. The speed of change matters enormously. If someone's memory has been slowly declining for 10 years, that might be normal aging. If someone's memory noticeably worsened over 2 months, that's more likely to represent a medication effect or another treatable condition worth investigating. The pattern, slow and barely noticeable or relatively rapid and pronounced, helps distinguish normal aging from medication impact. Individual risk assessment also matters. Are you over 75? That amplifies medication vulnerability. Do you have kidney or liver problems? That means medications stay in your system longer and accumulate more. Are you dehydrated? That concentrates medications and increases brain exposure. Is your sleep poor? That impairs cognitive resilience. Are you depressed or anxious? That can either mask or accelerate medication-related cognitive effects. Are you taking multiple medications simultaneously? That multiplies risk. None of these factors guarantees a problem, but all of them increase your individual vulnerability to medication-related cognitive changes. Do not stop taking medications on your own. That needs to be said clearly because fear sometimes leads people to abruptly discontinue medication, and that can be dangerous. Suddenly stopping blood pressure medications can cause strokes. Suddenly stopping benzodiazepines can cause seizures. But here's what you should do instead. Start by documenting your medications. Write down every medication you take, including over-the-counter ones, herbal supplements, and over-the-counter pain relievers or sleep aids you might use occasionally. Include how long you've been taking each one and what dose. This document is your foundation for the conversation with your doctor. Many people cannot accurately remember their medication list, and doctors' records are sometimes incomplete or outdated. Next, document any cognitive or memory changes you've noticed. When did they start? Have they progressed or stabilized? What specific changes have you noticed? Be as specific as possible. Instead of, I'm forgetting things, write, I'm forgetting conversations from yesterday, forgetting names of people I just met, struggling to remember why I went into a room. Specific observations are more clinically useful than vague concerns. Then ask your doctor directly. I'm concerned about how these medications might affect my thinking and memory. Can we review whether any of these medications might be contributing to cognitive changes? Be specific about which medications you're concerned about if you've identified them. Ask about alternatives that might carry lower cognitive risk. Ask whether any medications can be stopped because the original problem has resolved. Ask about dose reductions, if lower doses might work just as well. Understand that sometimes the benefit of a medication genuinely outweighs the cognitive risk. A blood pressure medication might slightly affect memory, but preventing a stroke is more important than slightly better memory. The goal is informed choice, understanding the trade-off, not automatically stopping everything. Work with your doctor to find the balance that protects your overall health while minimizing cognitive impact. Request regular medication reviews. Ideally, at least annually, but more often if you're on multiple medications or experiencing cognitive concerns, request that your pharmacist review your medications too. Pharmacists are often more current than physicians on medication interactions and can spot concerning combinations or duplications that doctors might miss. Finally, understand that some medication-related cognitive effects are reversible. If the medication is stopped, memory and thinking clarity sometimes improve. But if the medication continues for years, some changes become harder to reverse. Early recognition and conversation with your doctor matters. The sooner you address this, the better the potential outcome. You now understand something that most people don't. The medication seniors take for legitimate health problems can affect thinking and memory. The connection is real, documented, and often overlooked. The awareness gap between what medical research shows and what patients and families know is substantial, but you've crossed that gap now. You have information that allows you to protect yourself and the people you care for. Here's the most important truth. Awareness is protection. Knowing that medication cognition effects exist and knowing how to recognize them means you'll notice changes early rather than late. Early recognition creates the possibility of intervention. Late recognition means changes may have accumulated beyond easy reversal. The difference between noticing something at month 2 versus month 18 is profound. I want to reassure you about something. Noticing a memory change doesn't mean dementia is inevitable. Many medication-related cognitive effects are reversible, particularly if caught early and addressed with your doctor. Some people reduce or change medications and experience memory and clarity improvements that surprise them. Some situations involve balancing competing health needs, where the cognitive effect of a medication is worth accepting because preventing heart disease or managing pain is more critical. The point isn't to panic about all medications. The point is to be informed, to pay attention, and to have thoughtful conversations with your doctors about brain health specifically. If you recognize changes in yourself or a loved one, the next step is straightforward. Document what you've noticed, gather your medication list, and ask your doctor specifically about medication-cognition connections. That conversation might change everything. Your doctor might identify a medication that was prescribing years ago that no longer serves its purpose. Your doctor might suggest an alternative medication with lower cognitive risk. Your doctor might discuss dose reduction. Your doctor might simply acknowledge the connection and work with you to monitor any progression. Whatever happens, you've moved from guessing to knowing. Here's my question for you. What medication concern worries you most for yourself or a loved one? Share it in the comments below. Your comment might prompt others to have the same conversation, and that awareness might protect someone else's cognitive health. If you found this information valuable, please subscribe. On this channel, we focus on the health realities that matter most to people over 50, the things doctors sometimes don't explain clearly, the connections people miss, the knowledge that allows you to protect yourself. You deserve that clarity.